Welcome to Sit and Stay, the podcast that breaks down the challenges of starting and maintaining a mental health practice into digestible chapters. Sit and Stay is presented by RipsyTech, an electronic health record company committed to addressing the mental health crisis in the United States.
Hey Tom, how's it going?
Parker, good. Nice to see you today.
Yeah, we're starting this podcast for RipsyTech.
Very, very excited to get rolling with the podcast.
Yeah, so to just give people a little bit of introduction about what we're doing, this is the Sit and Stay podcast from RipsyTech. I am Parker Anderson, the product manager at the company, and you are...
Yeah, I'm Tom Tarshis. I'm a child psychiatrist and researcher, epidemiologist, biostatistician, and moderate software engineer, and founder of this company and a few others.
So you want to say a little bit about, what is RipsyTech? If for any reason somebody is hearing us for the first time and wondering, what does this company do? What are they all about?
Yeah, RipsyTech is the culmination of 12 years of work towards building a better software product to help take care of patients with mental illness. It was something that was born out of struggles back between 2009 and 2012 to find an electronic health record vendor that actually had a product that was easy to use for clinicians and focused more on taking care of patients and patient outcomes as opposed to billing and money or something an administrator would like. After spending 3 years trying to find such a product, finally threw my hands up, and because I was a software engineer for a few years before I started this path through medical school, said, hey, I'm just going to write the product myself. So began in 2012, really as myself, and then over the years added people to the team, most notably met a great software engineer through a mutual friend who lives on a beach in Hawaii in 2014. The team was mainly Bruce and I for a number of years, but then in 2020, 2021, we built up our team, including you and some other people coming on as we got the product ready to be launched. Of note, I started some mental health clinics in which we had 4 sites throughout the state of California and have actually been using the RipsyTech product since 2017 with hundreds of clinicians. But now we've put finishing touches on the product and are ready to release it to the rest of the world, really, and hopefully take advantage of it being a psychiatrist designed and founded EHR, easy to do medical records and easy to track what's happening with our patients. This was not a company founded to make money and then sell at a high multiple later. It was a company founded to address the mental health crisis we have in the United States. Ooh, got a little long-winded. Sorry about that.
No worries. I mean, that is all really great information. And I think it paints a really good picture of you, the company, and what our goal is all together in everything that we do. So you mentioned that you had started your own practices and you had up to 4 in the state of California. What inspired you to do that, and what initial steps did you take to make that into a reality?
Gotcha. Yeah, good question. And try not to bore people with a little bit of history, but just to talk about my career path. I'm a Bay Area native. I went to UC Berkeley as an undergraduate student. Towards the end of my time at UC Berkeley, started working on some research projects, which got me very excited and interested in research. From Berkeley, I went to the University of Michigan to get a master's in public health and epidemiology and biostatistics, and then decided to go the MD route instead of the PhD route for various reasons. So when you go to medical school, it kind of takes 10 years of your life doing this process, but went into medicine. Can talk more about that later. And then after medical school in Detroit at Wayne State, headed off to Arizona for training in adult psychiatry. Even though I knew I wanted to be a child psychiatrist and work with youth, you have to train with adults first. And then came back to the Bay Area to train at Stanford, doing a National Institute of Mental Health and Child Psychiatry combined fellowship. At that point, I felt I really wanted to stay in academia because I loved research so much. But a little bit into my fellowship, I also realized I don't like bureaucracies, and that if something's broken or done the wrong way and you want to fix it, it's very difficult in very large institutions to even get the smallest changes pushed through. So while I was finishing my training, I started my first entity, which was a nonprofit entity called Bay Area Children's Association. And from there, just trying to do the right things in this field in how we take care of patients and have a great working environment and place for clinicians to work. Some of my colleagues heard what I was doing, and pretty soon we began growing and expanding and providing a lot of services throughout the state of California. And that's kind of been my path through this whole piece. Is there's a lot of reasons why the mental health care system is broken. One has to do with nuances to this field of psychiatry and mental health treatment. The other is a lack of good technology, record keeping, and research on outcomes. And so that's bringing my interests together. I started the companies myself because the best way to deal with something that's broken, if you want to fix it quickly, is to be in charge. So when someone would come to me and say, this isn't working well, all right, let's fix it. You don't have to apply to 3 different levels of management and get some signatures signed off on and deal with political or other bureaucratic interests. You can just get it done. And so that is why I like being in charge of my own practice. And it's one of the great things about being a mental health clinician. It is still a field of medicine, or of any field, that you can go out and start your own business pretty easily. And we want to be there as a support for people who are up for this to help guide you and avoid some of the negative lessons I've learned over the past 17 years.
Excellent. That is great stuff. Great to hear. So, as you put it, there might be different types of mental health providers, from psychiatrists, therapists, social workers. There's such a variety in this field, and any one of them could choose to start their own private practice. And you did it, and you're talking about how there have been multiple learnings over the years. So that's really the frame that we are approaching this whole podcast from. You should see episode 1. The episode should be called Getting Started with Your Private Practice. And so, keeping that frame in mind, could you outline, maybe for those who are maybe the students that are listening who are thinking about, hey, should I start my own private practice when I get out of school and I'm done and I've gotten fully licensed? What are the different steps involved in starting a private practice for anybody who is having those thoughts that has never taken that leap before?
Yeah, I'd be happy to. I wonder, Parker, though, if we could turn the tables a little bit, have you share your background.
Oh.
How this is the second, actually it's the third company I've had that you've worked for. And maybe you could just share a little bit about your experience in this mental health field. And
absolutely, that totally fair. I can absolutely 100% do that. So in my case, I went to school at UC Santa Barbara as a psychology major, and I finished up around then, and I wasn't really sure what I wanted to do. I remember my mom telling me, hey, if you want to do anything with your psychology degree, you got to go get your master's. And I thought, what? I don't want to go back to school. So I just was, at that point, I was trying to figure out what I wanted to do. And I'd spoken with my dad, and he had reached out to somebody that I knew growing up reached out to him, who was kind of looking to get connected, and he was working as a mentor for a completely different company. And he said, "Hey, can you, do you know anybody who might want to work with me as a mentor?" And my dad said, "Hey, my son, he's doing psychology. Maybe he'd be interested in that." And so my dad kind of told me to go talk to that guy because I already knew him. I talked to that guy, then he it's quite a. I'll try to keep it short, but that guy connected me to one of your employees, and he said, "Hey, there's this place called the Bay Area Children's Association. They're doing great work. You might actually be a really good fit over there. Let me connect you to my guy." And then I met, that quote unquote guy, and he and I just hit it off on day one, and it was a nonprofit organization, so he said, "Hey, do you want to come volunteer in our intensive outpatient program?" And I said, "Sure, that sounds like a good time." And, well, I mean, it was an eye-opening experience for me because I didn't really know what I was getting myself into. And I fell in love with it. I had a great time with it. It was incredibly rewarding work working in youth-based mental health programs, where that was a very first time experience for me to have somebody take that chance on me, to ask me to be there and to be a part of that. And so I volunteered with your company for about 5 weeks, and then you guys said, "Hey, why don't we start paying you to do this?" And I went, "Oh, okay, that'd be great." And eventually, after about 7 months of doing that, I was, still out of school, still trying to figure it out. You guys offered me a full-time job, and then that just kind of evolved over time. I was there for a while, and at a certain point in working in those programs and just being involved with a lot of the different parts of the process, I started to then go back to that question of, what do I want to do for my master's degree? And it was between, do I want to pursue this and do potentially a marriage and family therapy program, or do I want to do something a bit more numbers focused? Because I have always kind of been really into numbers and how they work, and trying to challenge myself to do the things that I think that I can do that are difficult. So after having a few conversations with people, I decided I was going to apply to both types of programs. One, a research style of program, and one, a marriage and family therapy program. And at that time, I didn't really have a lot of research background, so I actually reached out to you, being the big boss at the clinic, and you encouraged me very early on to pursue whatever research interests came to mind, because the clinic was doing research. And we actually had two ideas, and instead of saying, "Hey, let's do this idea," you just said, "Let's do both." And then we submitted both to a conference, and then a few months later, before I knew it, we were talking about two different posters back to back, like right next to each other at the exact same time. And that I really got a kick out of. So I ended up pursuing the research degree, went and got my master's, and then after my master's was done, and I wasn't working for you anymore, it had been a couple of years, I reached out and said, "Hey, I know how to do research now a bit better than when we started, and I know you guys do research, so I'm looking for a job. If there's anything that you have that you can help me out, that would be great." And I think we connected, and we both kind of like lit up at the possibilities, because I was also at the time really trying to get into user experience, like user research. That's a big part of like software, and developing softwares with making informed decisions about your users through research, and then incorporating that into the design. And so you were talking about building up RipsyTech, and we both were just talking about research, and it just seemed like the best fit for me to kind of pursue the design side of things while also keeping an eye on the research side of things. And the rest is history. It's been a few years now, and now I'm the product manager, and it's just been a great experience. I maybe have talked for quite a while now. I have no shortage of information that I can share about myself, but that's essentially where I ended up, where I am now. And I'm just thankful to still be here and working. It's been just one learning experience after another working with you. And now we're doing a podcast. So
yeah, and the tables are turned a little because you are the experienced podcast person, but I think Parker, you've done a great job with, and this is another, I think, core piece of who I am and what we need to do in this field is mentor people and inspire them. And the goal is always, if someone has a little bit of interest, take them, get them excited about that interest. Don't make them shift what they want to do into you as the senior person, but let them explore their own ideas, which you had a lot of. Yeah, let's go to a conference. You definitely got bitten by the do some research, present it, talk to people. And I think that helped maybe shape your path a little. And it was very fortuitous that you got very interested in user experience with software and designing great software experiences, which is what we're trying to enhance with RipsyTech so that everyone who comes to use the product for their practice has a great experience. And we're again in this situation where, yeah, if something isn't awesome, please let us know and we'll fix it right away. And so, yeah, it's great to have you on board. And it's been a great seeing your path develop over these past 7-8+ years. Yeah.
Has it really been that long? Wow. Yeah, I'm thankful to be here and thankful to be pursuing something as interesting as a podcast, which is like a total, I wouldn't say curveball, but it's just something different that we get to try out because we're a smaller company. And as you put it, I've had kind of my own creative endeavors outside of work for a while, and podcasting was one of them. So for you to suggest this idea was a very cool moment for me to say, hey, this is something that I just do for fun, but now my boss is asking me, let's do this professionally. So absolutely happy to be here, happy to have been mentored by you for so long. So thank you.
My pleasure. Yeah. So do you want to repeat the other question that I sidetracked us with? And
yeah, no worries.
Jump into that.
So the question was, we were talking about the steps to starting a private practice. The frame I put it under was anybody who is considering starting their private practice for the first time, what are some of the important key steps involved in taking a project like that off the ground?
Yeah, and a lot of it is some basic business steps. But as I mentioned a little bit earlier, being a mental health clinician gives you a very easy path to start your own business. In fact, 50% or more of people in this field actually run their own solo practice or start a group practice, which is fairly unheard of in other industries. But there are a lot of features to being a mental health clinician, such as low overhead, very high demand, that make it a business that's easy to get started with compared to starting other types of businesses. And the most straightforward way to start your practice is really less than 10 things you have to do to get going, to get your practice set up. Just to run the list, the first thing you should do, which takes half an hour or less, is to get your own tax ID number. In general, you don't even really need to do this because you can use your social security number. You can file a Schedule C on your personal taxes for business income. However, I really recommend that you get the tax ID mainly in this field because if you run a cash practice where you're going to be submitting a super bill to your patients to get reimbursement, or if you decide to take insurance, you'd rather not be putting your social security number on every single bill you send to patients and on every single insurance claim. So it's very easy to go to the IRS website, put in a little information and generate it's called an employer identification number, EIN, synonymous with taxpayer identification number, TIN. So that's really step one. It's also step one to starting as a part of any business that you might start. Step 2, which is critical, is to get malpractice insurance. I think most people going through training in whatever field as a mental health clinician, this piece will be repeated over and over. And I think there is in our world, we tend to see a lot of teaching by fear. And I would say even personally in my training through medicine, you hear a lot about being sued, or people are, you're definitely going to get sued if you're a doctor at some point in your career, which I don't really think the statistics support. But in any case, it is important to get malpractice insurance. For those physicians in psychiatry, we are actually near the very bottom of physicians that get sued. I think adult hematology oncology, people who treat cancer, have very low numbers. But psychiatry and child psychiatry are also very, very low numbers of people who get sued. And we can have another podcast about that.
Sure.
In addition, other mental health professionals, it's a very low probability of being sued. And with a little thoughtfulness in your practice, it's not something you should worry about. However, all types of business insurance are important. Malpractice insurance is not a big expense. It also is not burdensome to get, and you can retroactively date it. So even though I have it listed as number 2, when we've applied for malpractice insurance for different businesses, we've always been able to go back and choose the date we wanted the insurance to start. I can mention we're not sponsored by anyone or anything like that, but our groups use a company in California called Medical Insurance Exchange of California, MIEC, which is a nonprofit agency that is run by clinicians. And they have some features in their malpractice coverage that I appreciate. And if they have money left over, they tend to return it to people who've paid for the insurance.
Oh, wow.
But yeah, so that's who we use. There are a lot of other malpractice insurance companies. I'll say that if you're a new practitioner, there's very significant discounts on malpractice. So as a child psychiatrist in a solo practice, you're probably only paying $1,000 or $2,000 a year for this insurance. And even when you're fully licensed and have been practicing for a while, it's going to be less than $5,000 a year. If you're a psychologist or therapist, the numbers are much lower. I don't even think it gets up to $1,000 a year for your malpractice insurance. But that is what I have as step 2. It's an important step, not burdensome to do as well.
Excellent.
After that, you've got to have some method for communicating with your patients, and we want to get something that's HIPAA compliant. So ultimately, you need a HIPAA compliant system for messaging. I'm a really big fan of the HIPAA compliant G Suite, especially as working in the nonprofit now, you get very significant discounts in the nonprofit structure. But even if you're not a nonprofit, it's very reasonable pricing to get HIPAA compliance with Google. The reason I like the HIPAA compliant G Suite is your emails, your calendar system. If you want to get started quickly and need something to write your notes, you can just use your Google Docs until you get an electronic health record. There are other vendors that make HIPAA compliant products for managing your practice, but really a fan of G Suite, again, not being sponsored by them. And it's a quick, very quick sign up. So I'm all about efficiency. So if you can sign up for your messaging system in less than 30 minutes, then that's a win in my book.
That really is, that's a really great point that you brought up, that you can just stick with something like G Suite, because things that I've learned from just learning more about business is that in order to help a business run, there's so much technology that you need to make sure that you set up in order to make every part of the process run efficiently. And in this case, it is a business, but it is your business. And for the fact that you can get started with just one product before you maybe use an electronic health record, as you mentioned, that is great. That it takes care of so many of the initial barriers of choosing. From a bevy of choices, it just kind of comes down to, you just have to make one, and it's all right there. That's excellent.
Right. And in our clinics, we've also been pretty happy with HIPAA compliant Google Meet. I would say that it's gotten much better over the past few years. Initially, I would say that it wasn't as good as Zoom for some of the video quality, but there's pros and cons to each product that might work for telehealth appointments. I would say at this point in time, although we prefer doing a hybrid type of office where we can see patients in person, especially if you're working with kids below a certain age, it is difficult to do telehealth sessions. But in general, we've been very happy with using Google Meet as our telehealth product. And that also solves another piece of starting your practice, that you can sort of skip the whole step of getting an office, buying furniture, if you're just going to do a telehealth practice, which a lot of people in this field are now doing. And there are a lot of pros to that. It opens up services for people who live far away, especially in people working with kids with a huge deficit of providers. Telehealth has made those services accessible to lots of people. So we've been very happy having that available at no extra cost to use the HIPAA compliant Google Meet services.
Yeah, that is great. I think, we could even dive further into that for a whole other episode about, getting your office set up or getting your telehealth set up, telehealth do's and don'ts. And then when you do decide to have your own in-person practice, what are, some of the decisions that go into that? There's a whole lot that we can get into there. And I think we have a future episode planned out for that. But yeah, great. So what are some of the remaining steps involved with?
Yeah. Good. Yeah. So just a couple steps left for basic starting point. Next on my list, I have get an electronic health record. So as I did just mention, if you're really eager to get going and have something like HIPAA compliant G Suite, you could certainly get started and write your notes in a Google Doc. But ultimately, for lots of reasons, you want to get connected with an electronic health record. There is something called Open Notes, where patients have access to their health records, which if you're just keeping your notes in a Google Doc or Microsoft Word doc, that can create some problems. Definitely, we would recommend our product at RipsyTech as an electronic health record. So, I always come back to electronic health records. When I started in medicine, in medical school, there were no electronic health records. This was the late 1990s. And so what did we do without electronic health records? Well, we used essentially paper and pen to do all our notes. Mm-hmm. So you would hope that technology and software design could actually do something better than paper and pen, but it's an interesting thing in this field of electronic health records where, although it's been getting better, at different points in time, 90% of people would have rather gone back to paper and pen than to be using electronic health records, because people made these systems overly complex. And I think a lot of them were designed by non-clinicians. So I'm a big believer in technology needs to make life easier and not more difficult. And here it took a long time to even get a product better than paper and pen. And the EHR dissatisfaction rates are still above 50%. And it's even higher numbers when you're asking mental health clinicians the least pleasant part of their job, which is using their electronic health record to do their documentation. So that's been a core tenet of our development for our product. Make something that's easy to use, not overly burdensome. intuitive, so you don't need to spend hours and hours of training. Before we started using our product, we had another vendor, I won't mention their name, but the support was so bad for all my clinicians. I had a 45-page document with screenshots just so you could know how to write a note after you see a patient. And that's just a ridiculous failure of technology when you have to make a document like that to do something as simple as write a note about your patient. That's why we started with note completion and note writing, and that basic principle of keeping it intuitive hasn't changed over the years. I think we were waiting for our commercial launch to get our full billing module in place, to get some other features to get your notes done quickly, and to add other practice and productivity tools that are nice to have. But that's an important piece for your practice. Of course, we recommend our product. We have very good pricing. I think we're ideal for new graduates because when you sign up for RipsyTech, you're signing up to have me and you and the rest of our team there to guide you, not just if there are any issues with our product or enhancements, but also to help you get your business going and be successful. Is a pledge we make. We do have advantages being a mental health only electronic health record system and not working with other disciplines. So we can take it easy on, there's not a lot of radiology, there's not a ton of labs, there's not a lot of videos that need to be recorded and put into the medical record or things like that. So we've tried to take advantage of all those pieces to make the best product out there and keep evolving. And I think like we talked about earlier, there's no bureaucracy at our company. So we have very easy places to put feedback in our EHR, and we love getting feedback from our clients and users, and people have great ideas. We see something we like and boom, it's ready to go next week. And I love that about our company.
I concur. I love all of those things too. It's really great to be working somewhere where we can really back up the fact that we're saying that we are available as a resource for the people that sign up to use us. I mean, I think of any technology company that you use, you encounter any kind of issues, then you get on the phone with somebody who is the support staff, and maybe they help you, maybe they don't. You can have very mixed experiences when you're working with something like that. So in our experience, to be able to say like, hey, I am trying to, I'm here to help you. I'm here to be a resource for you. And I'm also somebody who helped design this. So this is my bread and butter, hearing your feedback, hearing your problems. I thrive on your problems. You're giving me the things to do that are going to, help other people use the system. So yeah, absolutely. We love getting feedback.
Yeah. No, and this product is designed to be a solution to part of the mental health crisis. If we can streamline the most unpleasant part of clinicians' jobs, which is this documentation, so you have more time to do what you love, which is working with patients and their families, then that's our success metric and what we're going for.
Absolutely.
After the EHR, you do need to decide what you're going to do for accounting for your business. So
yes,
you need to get paid. You'll need to send invoices out. If you're going to be doing just a practice where you don't accept insurance, which again is the majority of practices in this field, and we'll talk more about why so many people don't accept insurance, which is there's a lot of reasons for that. Mm-hmm. But if you're just setting up your own practice for your accounting, you're going to look at different CPT billing codes that you're going to use in your work. Again, an advantage in mental health is there's literally less than 20 if you're a physician and less than 10 if you're a non-physician that you need to learn. You're going to set a price point for what you charge for these services. That will be another episode on figuring out what your price point will be, and is there any way to do this logically, and what is an RVU or relative value unit, but too much for this episode. But you're going to decide on your charges, and then you're going to decide on how to keep track of your accounting. When I started, it wasn't even QuickBooks Online, but I got QuickBooks and thought, I'm going to learn a little basic accounting myself. If you're starting out by yourself and don't have too many clients, I think it can be good practice to do accounting yourself and see where your expenses are going. And there are a lot of systems that are easier to use now. That being said, after a few years and after I realized a few mistakes I had made in my accounting, I now rely on a great accountant to help me out. And there are different levels of doing this. You can have an accountant do everything for you, or you can hire an accountant for a few hours each month to sort of review what you've done and make sure you've done it correctly. But just to emphasize, you do want to make sure that you are doing your accounting properly to save yourself heartache. Part of that piece then is also helpful for figuring out how to pay yourself and how you want to pay yourself and other items like that. And those are really the 5 basic things you need to think about to get started. I will say the other step, which can also be done retroactively, is looking at business license requirements. So this can vary by city and state. So it's sort of see what city you live in and use Google to figure out what you need to do to get a license. Most cities do require a business license. Speaking for California, if you're running a sole proprietor business in California, the state does not require any type of business license. There are advantages to incorporating your business. That is probably another topic for another podcast. Are you going to be a nonprofit or a for-profit entity if you decide to incorporate? It's another big topic with pros and cons. But check out if you need to get what licenses you need. Again, this is also one that can be done retroactively after you start your practice. The other piece to think about is just to make sure that you're licensed to practice as a clinician, that you've done everything you need to do for that. And one great thing about our field is even before you're fully licensed, often you can start seeing patients. Especially if you're doing a cash practice. If you have an associate or mid-level license, you can often start seeing patients before you're fully licensed. There are other requirements around that and around having a supervisor, but that's the other thing to look into before you get going with your patients.
Interesting. So I was actually not aware of that. So you're saying as an associate who has graduated from their master's program and, say, let's go with a marriage and family therapist just for the sake of example. If I'm an associate marriage and family therapist, I can potentially start my own private practice to, acquire my, 3,000 hours to licensure. But I would need to get a supervisor who is, I guess, supervising those hours as part of my private practice. How does that work?
Yeah, good question. And I think your 3,000 hour number for the state of California is correct. But once you finish a lot of your graduate work and seeing some patient hours, you can get your associate license, become an associate MFT. And after you have that associate license, if you have a supervisor, which I believe, again, it varies. And I believe in California, for every 10 patients you're seeing, you need to have an hour of supervision by a fully licensed practitioner, and you need to have someone who's available for you as needed as you're working with your patients. But you can actually start seeing patients as an associate if you have the right supervision in place. And in addition, this can be a great way to also accumulate hours towards your degree and bring in a little extra revenue as well. And there are similar pieces to the licensing steps for master's level providers, for PhD or PsyD level, and for MD providers, where you can start working and seeing patients before you've fully finished your training.
Wow. I just learned something new. That's great. Okay, so we've gone over the steps. We've gone over introductions. We've done a lot so far. Maybe this will just be our bulkier first episode. So I did have a couple more questions that I wanted to brush on before we finished. And those were, first off, in your experience, what would you say were the most significant challenges in the initial phase? And what are some suggestions that you have to address them?
Yeah, good question. Very loaded. I shouldn't say loaded, but full of memories of trauma from when I started the practice. No, definitely not trauma. I would say, as I alluded to earlier, that bringing in an accountant a little bit earlier to review what I had been doing would have been a great idea. Just to share one initial mishap, when you run a business, you need to pay estimated taxes to the IRS, and I had been paying estimated taxes properly, but I hadn't been submitting a piece of paper saying that I was paying those taxes. So I got hit with a huge penalty from the IRS early on. And then I learned, let me get an accountant and get a little extra help with some of the tax pieces. Because I made the decision to take insurance straight away, the majority of the learning came from dealing with insurance companies, billing, reimbursement, negotiating rates. I've helped lots of people over the years understand that when you apply to be with an insurance and they send back, here's what we pay, this is non-negotiable, that is not true. And there are a lot of things that have happened in the past 17 years, but mainly just in the past few years, that make it a little easier now around taking insurance and some more transparency around insurance rates. And then being aware that if you do take employees and grow your practice, that there are other complexities that come with that. If, for example, if you're a solo practitioner or you work with another family member or partner, you do not need workers' compensation insurance. If you're the owners of a business, don't need workers' compensation insurance. But the second you hire someone, even part-time, to help manage your schedule, which you wouldn't need to do with our software because the calendar system is so great. But the second you hire anyone else, you've got to get a workers' compensation policy in place. That is required by law, and it's a protection for you. So I think it's, those are some of the things that were learning experiences for me. I definitely did not have a workers' compensation policy in place, probably for 6 months after I hired my first people. And I was fortunate nothing bad happened in that time, that no one slipped walking into the office or anything like that, because that could have ended the business.
And those things, they will happen over, statistically speaking, over a long period of time. They will happen. So, that's a great note. So I guess on that note, what advice would you give for anybody who, all right, I suppose, what advice would you give for staying motivated during more challenging times?
Yeah. And, most people who decide to work in mental health or to be a clinician who works with patients, you've come into this field because you wanted to be in a field for helping people. You didn't, again, choose this. This isn't going into business. This isn't going to work for a software company. This was, you're a person who's passionate and dedicated to helping others. And that's what you want to spend your time working on. So, ultimately, whenever you're having challenging times with patients will happen, as everyone who knows that in this field. And usually through training, you get connected with clinical mentors that are there as a resource for you working with difficult patients. But what we don't get enough training for are those business things, finance things, insurance. What do you do with the patient who won't pay that owes you money? That's often not discussed as a piece of your clinical training and mentorship, even though it should be. So in those challenging times, remember why you went into the field. And the advice would be to find someone who's done what you're doing and has more years experience dealing with some of the non-clinical items you haven't been trained on, and seek their guidance and their help. I will throw a caution there in that because there's a lot of small or solo practitioners in this field, you could essentially practice your whole career and be doing some things not quite by the letter of the law, and it will never hurt you because you're one person working in a room. In fact, the person whose office I took over from was a practitioner, and they just have never gotten a business license at any point in their career, and they've retired, and it hasn't affected them. So when you're going to seek advice from someone regarding some of these non-clinical or business type questions, just be aware that sometimes people in this field are not the most business savvy and are pulling from personal experience and may not have all the right answers. And you really want to make sure, well, in all circumstances, you want to get mentors that are humble and are quick to say, I don't know, or I'm not sure if that's the case. And that's certainly how I try to operate when I'm mentoring people. So long-winded answer about how to deal with some of the challenges that come up.
No, I mean, it's great. That's, yeah, I mean, advice like that can really go a long way. And I appreciate that you highlighted that, maybe it's best to get your information from a variety of sources rather than just relying on one, and using some critical thinking to kind of find that critical path that is right for you.
Very good. Yeah. Well stated. Yeah. Having multiple mentors on different topics or the same topic is great advice.
And I mean, not even just in this, just in life. So
very true.
So before we wrap up, I believe you wanted to talk about a mental health business moment of the week. Do you want to go ahead and share that?
Yeah, and I thought as a little fun part, sort of it ties in well to your challenging question, because it's not like after 17 years those challenges don't come up. They come up quite often, and I have a couple to choose from. I think this one will be more of a story about dealing with an insurance company situation where, a lot of practitioners don't know this, but you can actually bill if you give your patients a questionnaire asking about how they're doing. This was a change that came about in 2021 where Medicare, which is the big government healthcare insurance policy for people over 65,
right,
and whatever happens in Medicare, other commercial insurance companies tend to follow. So Medicare made this changing where if you're going to do a questionnaire, which is very relevant in mental health because a lot of our outcomes are questionnaire based, that you could actually bill for these services. Now, it's not a huge amount, but it can be in the amount of $10 to $30 per questionnaire, depending on your insurance contracts. So I had sent in reimbursement for a couple questionnaires we did for a family. The insurance company owed me $18. And one of the features I built into RipsyTech that I don't know any other EHR that has this, but when we have a billing issue, which will happen, guaranteed, you can actually go into the EHR and log your insurance call. So you call the insurance companies, You get a reference number, you talk about the issue, and then you have to wait for them to respond. Well, for this particular instance, for this $18 that was due for questionnaires, the length of the call I was on for turned out to be 85 minutes in order for the insurance company to say, you're totally correct. We did not pay this, and we should have. So here's your reference number. Thanks for being on hold and for talking to us for a long time. And then 3 weeks later, the $18 showed up. But
wow.
At some point, I think that is not the right use of anyone's time to spend 85 minutes on a phone call for $18. I believe it's definitely below California minimum wage standards. That being said, if you're stubborn and persistent and, it's the right thing to do, or it's justice on some level, I felt compelled to follow through with it. And fortunately, I tend to be able to multitask and do some other stuff while I'm on hold. But yeah, that was quite a frustrating experience. Definitely atypical for hold times. And that's something that we're tracking and can talk about other theories around why so many insurance claims get denied for no real reason. But again, topic for another podcast.
Right. I guess all I will say is, that 85 minutes, even though it was for $18, likely goes a long way, long term. Now you kind of know your experience of, billing for something like that, for them to tell you after that 85-minute investment that, you were correct. That does give you the confidence to bill similarly in the future, which I'm sure, those 85 minutes will get paid back eventually.
Great. Yeah, no, great comment. And I'd say it hasn't been that long that we've been billing for questionnaires. It is something that's important for our field and something all clinicians should be doing. And, that revenue over a year will add up to thousands of dollars in your pocket that you are entitled to. And now I have a reference number from that call. So the next time there's a denial, there is precedent set with this insurance company that,
right,
hey, look up this reference number. Here was the error. And it was, as you said, hopefully a worthwhile 85 minutes to spend for the learning that went along with it for the future.
Well, great. I would say that this is a great time to wrap things up. Thank you for having all these conversations, answering all of my questions. This has been a pretty enjoyable first episode, I would say.
Yeah, it's been fun and great. And I look forward to delving deep on other topics. And anyone who has questions about anything related to mental health practice and the business aspects of it, or, maybe even we'll do some clinical episodes at some point, but
yeah,
please get that information to us. And Parker will have that information to send in.
Yeah, I can put it in the description for the podcast. You can also go to our website at www.RipsyTech.com, and on there we have a couple of ways to reach out to us. If you have any questions, feel free to submit them either via email or on one of our contact forms, and we would be happy to address that with you. And then, submit some questions. We'll, I'm sure at some point, like to do a community Q&A episode to answer some of those questions.
Awesome. Thanks, Parker.
All right. See you later, Tom.
Take care.
Bye.
Thank you for tuning in to this week's episode of the Sit and Stay podcast. Until we meet again, we invite you to sit and stay with the ideas and stories shared today. Dive deeper into how RipsyTech can support your practice by visiting us at RipsyTech.com.